Okay, you should be all set to go.
All right, give me 1 second here. I just want to pull up a quick thing here. All right, there we go. Hi everyone. Thank you so much for joining us today. Really appreciate it. If you were on a previous one of these sessions, you don't need to be on this one as well. Just letting you know that this is a repeat of what we've done the last 2 times. We are recording this one for anyone who wasn't able to attend any of them. But so happy today to have with us Julianne Rosati, our Manager of New Business and Strategic Business Planning from Hackensack Meridian Health. We have Melissa Horowitz from Allspire, as well as Courtney Simonek from ORCHA. Did I pronounce that correctly, Courtney? Did I get that right?
Simonek, but
Simonek, I apologize.
It's okay. It's okay.
Just to kick off, I'm going to start off by introducing Melissa. Melissa Horowitz is a strategic project manager with Allspire Health Partners, where she focuses on digital health-related projects. She has a background in healthcare communications, health policy, and medical education. Prior to joining Allspire, she spent 15 years at the College of Population Health at Thomas Jefferson University, managing non-academic programming, including strategic initiatives, thought leader panel, and workforce development programs. And with that, I want to welcome you to today's presentation. Thank you for joining.
Thank you very much, Dr. Weiner. I'm also joined by my colleague, Courtney. Courtney, do you want to just give a quick introduction?
Yeah, hi everyone. My name is Courtney Simonek. I work with ORCHA. I'm the VP of North America here, and also have some background in the Department of Health for New York State and Health Information Exchange. So very much on digital health and digital data.
Thank you. So today we want to talk about the digital health formulary. We'll provide some background information about Allspire Health Partners and ORCHA. And we really want to spend the bulk of our time talking about the digital health formulary, why it was created, how it was created, the process of selecting the apps, and Courtney will give a demonstration of the formulary. And as we have time, we'll go into some use case scenarios. Any questions before we get started? So Allspire Health Partners, we are an alliance of 6 regional health systems that focus on healthcare quality and improve affordability and access to care for and best practices within the region. Your health system is a partner, as a member of Allspire Health Partners. So together we're working to improve quality for our patients and the communities we serve. Courtney, do you want to give a quick background about ORCHA?
Yeah. So ORCHA stands for the Organization for the Review of Care and Health Apps. We assess applications, digital health applications, for their safety, effectiveness, and quality. And we build platforms such as the digital health formulary that you're going to see for Hackensack Meridian Health to be able to select those safe and assessed apps and then also recommend them to patients. And we provide the data and information used to create the formulary and ensure that those apps meet those high standards set. So as mentioned, we create platforms such as the digital health formulary, which I will give a demo for in a minute. But this will enable you as a provider to recommend digital health applications that have been assessed for their safety and quality and effectiveness in a safe manner as well from the formulary. So it's meant to augment, enhance patient care behind your 4 walls that you practice in. And it was designed by healthcare professionals to empower you to make those informed and effective digital health app recommendations for your patients.
Thank you. Dr. Weiner or Julian, do you have anything to add before we move on?
So, I mean, basically the idea here, right, is to start using these tools that are out there. There are many of them. We're going to talk about the filtering process and how it works and kind of where we got to where we are. But I think that this is really exciting to start being able to offer these tools, both for us to explore and kind of try to understand them, as well as to start working with our patients with them to see how they're able to provide care for our patients. So, yeah, thank you.
Great, thank you. So the process, let me share a little bit of how we selected the apps. The process was a pretty lengthy and rigorous process. We established a work group of leaders from each of the health systems. And together we decided to focus on apps that addressed anxiety, depression, insomnia, ADHD, substance use, and addiction. And it was really important for the work group that safety standards and the apps were HIPAA compliant, had clinical supporting evidence, and were easy to use and affordable. So with the help of ORCHA, we were able to assess, analyze, and evaluate the apps. The work group members reviewed the apps. We had the app developers come in and present to the group. Some of the work group members even product tested the apps themselves. And the questions we were concerned about were data privacy. How was data collected? Where was it stored? And we looked at the evidence supporting it, and from there we whittled down the list to about 6 to 8 apps per category, and from there your formulary was built. Dr. Weiner, do you have anything to add?
So basically what we did, right, was we took this landscape of 20,000 apps, and then we needed to narrow it down because obviously we're not going to ask you to try 20,000 apps yourself or with your patients. Went and used ORCHA's assessment to really winnow the field. Again, had these kind of almost Shark Tank-like meetings with companies where they could present to us and we could ask them questions and understand how they work. And then from that, picked tools that we thought made sense for our network to start with to see where things are. I will tell you that we did not find apps for all of the categories that we looked for them. Part of that is because one of the things that we've been noticing is that a lot of the companies have been moving from a business to consumer model where your patient would pay for the app to a business to business model where they want Hackensack Meridian Health to buy a license to utilize that app with our patients, right? And this is something that we see over and over again. So we've seen apps that we wanted to work with, and all of a sudden the licensing changed. And right now, healthcare in general is trying to figure out who is going to pay for these tools and how. There's talk about reimbursement codes, things like that, but that's all still being figured out. So in the meantime, we were looking for things that were either available to us on a demo basis or available to us specifically where patients would be able to pay for that. And we're going to talk about that, aware of the concerns related to cost, but we did want to start somewhere. And so that's where we are with this.
Great, thank you. Courtney, do you want to take it from here?
Yeah, so as mentioned, these are the categories that are present in the formulary for Hackensack Meridian Health, and I'm going to go through the demo right now. So please stop me if you have any questions as I go. So let me just share my screen here. Here we go. So after this this training session, we will get a list to send out your credentials to get a login for this web-based formulary. So this is a URL that you'll have access to, and then you'll also create a login password. So once you log in to your account to the formulary, you will see the homepage of the digital health formulary for your healthcare system. Now, again, as mentioned, you can navigate the formulary 2 ways. You could search by condition or keyword here, or we have the categories listed below where you can utilize that, the categories. So for example, I'm going to click on ADHD. Let's say you wanted to look at the ADHD apps that are available. These are app cards. So for EndeavorRx in June, you could see here that it gives you a breakdown of what categories the app addresses. So neurodiverse, pediatric for Endeavor. It will identify the cost. So if it's paid, if in-app purchases means it's free to download, but there is some additional cost for premium features. And the bulk of what ORCHA does here is the assessment. So in the green box, 68%, you see our score to our assessment. So we have the digital health assessment framework is what we follow for the US. It addresses things like data and privacy, HIPAA compliance, evidence needed for the app to support its use. That is that score all rolled up into one. You see it for both platforms, Apple and Android. If the application has a web-based form as well, you'll see here for the computer for the web-based form. The level identifies what level ESF evidence needed framework for that application. So level 1 is the most basic, has the most general application features for the application. Level 2, 3, and 4, as those levels increase, help either manage conditions, have clinical calculators potentially, help diagnose conditions. So they require more evidence behind that app to ensure that it is safe, effective, and does what it's claiming it does. So that's where you see Endeavor, for example, as a level 4, because it helps manage a condition. It then requires more evidence to pass our assessment. So passing score for our digital health assessment framework US assessment is 65% or higher. You will not see any apps in this formulary that have failed. So every app in here that's available to you is safe and effective. It has passed our assessment, so therefore scores 65% or higher. So you can be assured that it is safe. Now, we do the initial assessment, but we also do ongoing reassessments as applications update. As we all know, applications update very frequently, and they must to ensure they're meeting security standards. So we reassess every time that that app updates in case there's any changes made. So you can, rest assured that these scores might change, and that's because we're reassessing them. If you toggle up, you'll see gallery of what the app looks like on your phone or device that the user is using. You can recommend from here by clicking on this blue box. So because this isn't the integrated, this is the web-based standalone formulary, you will have to type in first name, last name, and the method that you want to send the recommendation to the patient for. This is all secure, so either their phone number or email address, whichever way the patient prefers to receive that. And you can add it to your favorites if you feel like you are recommending the application frequently. You can do so that way. Now, I will say EndeavorRx is a prescription-based application, so there is a referral form that you have to complete as a provider, in addition to recommending this to the patient. We're trying to work with them to make that a little bit of a smoother process, but for right now, you can click here for the order form at the top of the box, or when you click into the application card, that provider referral form is right at the top for you to complete, and it will send you right to the referral form. Not all of the apps, it's just EndeavorRx that has that workflow. The rest you can just recommend as you normally would. And I'll actually show you for June, there's a discounted offer. So these applications, as Dr. Weiner mentioned, there is a cost to them for the patient, but Allspire has worked really hard to get discounts for our patients to use those applications. So June, for example, if you recommend this app to a patient, it automatically applies the discount that's applies to your patients at HMH. So you will see that automatically. There's nothing additional you have to do. It will send it automatically. Now you can also select these three dots to get the link to copy for this page if you want to share it with anybody else. From a provider standpoint, you could download the app yourself if you want to test it out. There are some trial application access that you can use to trial some of these. But I did want to click into here to show you that if you want more details on the application itself, we have a description, we have the highlighted condition areas, and then the breakdown of the score, which is really important if you want to know like what the app is actually doing from a data and privacy standpoint. Clinical assurance and safety is that level that I was talking about, that's the evidence that's needed to ensure that these applications are safe. So if you click on the clinical assurance and safety tab, you're going to see any relevant healthcare professionals that were involved in the development and production of that application, RCT observational studies that were done to ensure that the app actually is doing what it claims to do. So here you'll see any of the studies that have been done regarding EndeavorRx, and then additional gallery, additional general information features. And then again, as mentioned, the last time we reassess the application because we do that ongoing compliance for these apps to ensure that they are safe. So that's a really quick rundown of these applications. You can see your recommendation history, which is also a really big positive for this. So if you go back to the home page or even toggle to the left-hand side, you will be able to see the recommendation history that you have completed for your patients. So you'll see what app you recommended, when that was sent, and when that download link was clicked. So this is not actually the download of the app, but actually the link that I will show you. I pulled up the app. So if you send a recommendation to a patient, they're going to get this email. They click here to find out more, and they get a really nice description of what this app is, that there's a discount attached to it, that as normal, they can see more information of what the app is for and what it's used for, and then they can download it. So we're capturing this click of the download. Now there's a long disclaimer that comes up that is really great for just if they have any concerns, they need to reach out to their professional. We're not responsible, neither is the healthcare system, etc. They have to check that box, and then they go to download the application from here, in which case this is what I was mentioning. This is the discount applicable to your patient specifically. So I think the cost normally is $12.99 a month. So this is discounted for June for your patients. A lot of information, but are there any questions regarding what you want to see, the assessments, anything like that?
Courtney, can you share the information about Endeavor and just the additional process because of the physician?
Oh yeah, I was mentioning the referral form that you have to complete. So it's in addition to recommending the application, you also have to click this order form, or as mentioned, if you click into the app card, it's right at the top here for you as well. And that will send you right directly to the order form. You won't have to go anywhere else. Any questions? Anything to add, Dr. Weiner, Melissa, Julian?
So, again, we started with just some apps. We wanted to start with some that we had vetted and gone through with Allspire. If there are other apps, please let us know that you're interested in. We can talk to you about that. Some of them we know off the top of our heads at this point why they didn't pass the DHAF. Other ones we can certainly ask ORCHA to review if they haven't yet, in order to do that. Unless anything has changed, to my knowledge, we're the first healthcare system in Allspire that's going to actually start recommending these to patients. Other ones have looked at it, but they haven't gone that far yet. Please try the apps. We have demo codes if you're interested in them. We've been trying to maybe even get some iPads to pass around the offices. We're working on that too. But the ability of you to, try these things out, see what they're like, and then try them with some patients. And we want to hear your feedback on what you think. Is this working for you? Is it not? Where are the hiccups? Are you finding it helpful? That's all information we need. This is really new. Again, I don't think anyone else in Allspire is doing this quite yet to getting them into the hands of patients. So we want to see how this goes and get information from you in terms of where we are.
And I think the one thing I'll add, and you may have heard, I think Courtney mentioned it. Right now, we're not integrated with Epic. Obviously, that's a long-term goal, something that we would want to make life easier in recommending digital tools to patients, for all of you that are, accessing patient charts. But right now, really what we're trying to do is pressure test whether, you as clinicians who are working with patients, see any of these apps as useful. Obviously, navigating, that modification, as Dr. Weiner spoke to, in terms of a lot of these apps moving from the direct-to-consumer market to business model. So getting that, understanding of, what's the return on our investment in getting tighter aligned with some of these app companies, but something that we hope to look into down the line. It's also important, are the patients going to adopt this? What else do we need to think of? I know cost has come up in a couple of our other sessions, the concerns around that, which some of the app companies are, thinking of creative ways to discount that for certain patients, but a lot of things that are changing in the market right now. So that's why we figured, let's start testing. Let's get that, understanding of what works well, what might not work well before we proceed to the next step. But we'll go to Kimberly. You have a question.
I do. Thank you. My question is pretty much around the usage and the testing of this with patients. Is there a particular age or demographic or level of care that you're interested in particularly targeting? Or are there any exclusionary criteria that you can think of that might not be helpful for particular populations?
Yeah, I'm happy to talk about that a little bit. I think, when we think about the apps, can we go back to the slides showing the 4 apps that are available? I think it would be helpful to have that there, just because that's what we're working with to start. Endeavor RX, I believe, this is by memory, so I might be off. It's for use of between ages, I think it's 8 and 14, or I think. Endeavor RX is the prescription version of Endeavor that specifically has a cutoff in terms of age range. It's a video game that's supposed to help with ADHD symptoms. So for that, obviously, you want to stay in that. June is a tool for ADHD that's meant really for families to help their kids with ADHD manage their symptoms. So it's almost like you gamify things like making your bed, doing your homework, things like that. So it's really targeted more towards that with ADHD symptoms with adults. Endeavor has come out with an over-the-counter product for adults, but we did not have, thank you. Oh, it's 8 to 17. They expanded it. Cool. Thank you. It used to be smaller. So Endeavor RX is for ages 8 to 17. Thank you, Julianne. So you can use it for that. The adult version, there's a variety of reasons why it hasn't gone through ORCHA yet, and we haven't done that, but we'll look to expand that when possible. With Wobot, I believe the target audience is 18 and up, if I recall correctly.
Correct. Yes.
Right. So that's for that group. And then be mindful. I don't know if they have a specific cutoff on it, but it's really a mindfulness-based CBT program. And sometimes they kind of leave these things to provider discretion a little bit. But I don't remember if Be Mindful has a specific age range.
I think that's more for adults.
It is more for adults as well.
Yes.
Okay. All right. So that's generally where we are in terms of thinking about populations and ages. Most of these will tell you they were not designed for people with any acute suicidality, anything like that, right? Wobot does have some technology in it to look for safety. If a patient endorses anything that's dangerous, it can do some signposting to say, it looks like you might not be safe. Do you need some information? They can tell you to call 911 or recommend you call 911, but there's no technology that will bring that information back to you as the provider with Wobot. So again, when you're thinking about patients in terms of safety, it's not going to be doing that. Doesn't mean that it can't be a useful adjunct in some cases, but they really, when they talk about what they're doing, they were more targeting people who are not at that level of severity at this point. But they've said it's up to clinician discretion in terms of what they do.
We have a one-page overview sheet that we can share with you that has a lot of this information in it, and how it gives the key highlights of the app, talking points that you can share with patients as you're recommending it to them, and things like that. And then we are working to build a resource library that'll have all of the videos from the vendors, promotional material that you can look at and use to help. Someone else have a question?
Dr. Key?
Yeah, thank you. I had to miss 5 minutes to heat up my lunch, but I'm assuming the disclaimer, I hate bringing up the last resort catastrophe situations because I love this idea and participated in some of the earlier sessions with it. Is there a smart phrase in Epic that you recommend the clinicians use that mimics the disclaimer to kind of create the clear med legal line of what we're prescribing and the outcomes and what we have or don't have control over, which I'm assuming the disclaimer is the reason that the patients click that?
No, but it's a really cool idea and I like it. I think it's something that we can take back to our compliance team to get some language together to put in there. I think to your point with that, right, because this isn't integrated with Epic yet, because we wanted to get people to start using this and seeing how we do with it before that integration, with the time that integration takes. What we wanted to do is, make sure that you're able to get access to it. But please make sure when you are sending those recommendations to patients, obviously you're getting their permission to send them a text message or email them. That's important. But I love that idea of a smart phrase that we can put in the chart as well. So we can certainly start working on that. That's a great idea. Thank you.
Yeah,
Thanks.
and we will be collecting data, who is using it, who's prescribing it, who's using it. We're working with the app vendors to collect that information as well, de-identified information, just to get an idea of who's logging in, how often are they using it, did they use it for a month and then stop and then go back to it, just to get an idea. Any other questions?
Hey, Dan, I have a question. It's Arnesh here.
Yeah. Hey.
Use of this app, I just want to see the clinical space, when we are using these applications. So suppose you are in treatment with a patient for depression, right? And you suggest that, okay, this is the app I suggest for you to work with. Is it, meaning current practice models, what do they say? Is it like us suggesting something ancillary in lieu of what treatment we provide? Or is it a treatment modality which will be considered as that, okay, I told you to go for CBT and then this is extension of me providing you CBT. So where is the line drawn that, suppose a patient with depression comes and I told him or her that, okay, including exercise into your regime is also beneficial. So are we talking about these applications in those lines, or we are thinking of that as if I referred for CBT with an actual person? where does these application lie in clinical practice at this point?
I'm not sure that anyone knows the answer to that at this point. I think this is the stuff that we're trying to figure out with regards to that. I can tell you with these, first of all, I think it depends on how you're using it as a clinician as well and how you're recommending it, right? I think that for something like June, which is kind of gamification, while you can certainly check in and they have the ability as the therapist, there's a view for that to be able to kind of see where things going and everything. I think that's maybe a little different than using something like Wobot with a patient. But Wobot at this point, you're not able to get the information back from Wobot in terms of how often your patient is using it. We don't have that integration yet. So it's more of a suggestion the same way that when during the pandemic, when a bunch of the mindfulness apps were available for free, and we would say to patients, look, we realize you're stressed out about this. We're going to refer you, but here's another resource that might be helpful for you. I tend to think of it more that way. This is not considered I wouldn't consider this the same way as integrated treatment per se. Now EndeavorRx is FDA approved, so it's a little bit different there. But I don't know that I would consider it the same way that I would consider it referring to a therapist with all that comes with. At the end of the day, these are meant to be adjuncts to help us and help engage our patients, and we have to see how much they end up using them or not. Right. But it's not the same as a company that we've talked to that's more of a supplement where the therapist is trained to use this tool with the patient in order to work with them on it, almost like a workbook that you would have. That's not what most of these are at this point. Is that helpful?
Yeah, it is. It is actually. So basically, I'm seeing it as you said, adjuncts
Absolutely.
to the treatment provided, and see the engagement of the patient in that, whether it is patient is engaged and getting help on top of the treatment which you already are providing.
Absolutely. Look, and I think a lot of the companies that we've talked to, just in general, not these specifically, are basically saying, look, we're there for primary care, so the primary care has something to do before the patient gets in with their psychiatrist or their psychologist or their therapist or whoever. So I think that thanks, Kim. But I think that having these tools available as in behavioral health is a way for us to start using them, see where they are, and then we can then think about how we can expand that to other places throughout the network as well, moving forward.
Absolutely. Yeah, got it. Thank you.
I know we're at time in a minute, and I know people are dropping off, so I just want to see if there's any other questions or anything before we end. No. All right, well, Courtney, Melissa, thank you so much for joining us today. Really appreciate it. Thank you, everyone who was able to jump on. Really appreciate your time. If you have any questions, please reach out to me. Happy to help. You can reach out to Julianne as well, and we're happy to help navigate this. All right.
Thank you. And we'll be sending out information on how to access the formulary and next steps.
Awesome.
Yep.
Thanks,
Thanks, everyone. Have a great day.
Bye-bye.
Okay.
Thanks.